Hello everyone, it's Gene ID again. So today I am going to be showing you how to solve a case clinically. As you can see here, we had the first video was more of like solving a case anatomically, but now we are trying to solve it clinically. Um, so let's get on with it. So as you can see, we start by clicking on scenario. Again, you can always skip to the next scenario if it happens to be that you cannot solve this case. You can skip it at any time. So let's start. 18-year-old woman is showing symptoms of sudden numbness, confusion, trouble speaking, loss of balance. Use keywords to find the organ, system, tissues, and cells affected. So we've dealt with this aspect, which is the anatomical side. But in this now is we are trying to go for the clinical side. So we are trying to find the disease, name, treatment, options, and causes for the case. So that's what we are looking for. So again, we are trying to solve this case in a clinical format. You can also use hints for clues or codes. Beware, using hints will always cost you. So again, we've dealt with this. Uh, However, let's dive right in. So how do I get about solving this case? Again, I haven't seen this case before, so how do I go about solving it? All right, so I could start with hints, click on here like I did on the first video. And then what do I need? I know that organ is involved because based on the last video, each time I try to find the organ, it also boosts me clinically. So I guess I might just start with that since I'm more familiar with it. So I need to know how many organs are affected. So in this case, I would write organ, wait, organ dot number. Let's run this code and see. Okay, so as usual, um, one organ is affected. Okay, cool. Since one organ is affected, then what organ could that be? To be honest, I really do not know. But however, maybe knowing the function of the organ, could help me know what kind of organ it may be. So I will just go here, say organ dot function. So as you can see, I made anatomical progress because organ.function is the code for anatomy. So I made more anatomical progress than I made clinically, but I am not trying to complete anatomical case this time around. I am trying to complete clinical case. So now this means that I should use the answer that I got here to see what I can find clinically. So with the function of the organ, I could know which organ it is, right? So it says here, the brain, oh, it shows me what organ it is right off the back. So it says here, the brain controls bodily function and cognitive abilities, which makes a lot of sense because if you notice, it says that this 18-year-old woman is showing symptoms of sudden numbness, confusion, trouble speaking, loss of balance. So it makes sense to have that. It makes sense to be the nervous system or some sort of like a brain because the brain is part of the nervous system. So I'm already getting the sign that, you know, if I am solving this anatomically, then the system would be nervous system. But since I'm not, um, it would actually, now I think about it, it would be so easy solving this anatomically. But clinically, it makes sense. So I will just go ahead and write what it says here. Again, I could use check, or I could use organ, whichever one that works for you. Or I could just write the name brain, and it still works the same way. So, but I love to go with the original format, which is organ, uh, and then write organ. Let's do it this way, and then let's write brain. Mm-hmm. So let's see if we got it correct, and we did. So you could see here that the brain is affected, and we've made anatomy progress, but we also made clinical progress, which is the one we are aiming to go. All right, now that we know of the, sorry, give me a second. Now that we know of um the brain, which is affected, or the organ that is affected, let's go for the disease. Let's see what we can find. Maybe let's try hints. Let's see what we can find here. All right. So let's see, check options. Okay, name options. All right. So let me go further. So the name is also like the clinic is a clinical code. The disease is a clinical code. So what I'm gonna do here is to go with the disease. I'm gonna choose to see. Let me try disease dot cause, and let's see what it yields. And as you can see here, there's something that appeared. So the causes of this disease is high blood pressure, smoking, diabetes, you know, high cholesterol. So this is what causes symptoms like this. Interesting. Okay, so in that case then, what could now be the name of this disease? Interesting. Now I'm thinking to myself, all right, so I have the causes, I have the organ, and then it says here in interruption of blood supply to the brain leading to brain damage. So could brain damage be the name of the disease? I really do not know. So what I'm gonna do here is to use name that option, because it says here this key code gives you the list of disease names code in code anatomy. Oh, I see. There was a mistake in the spelling right there. We'll correct it. And provides, code anatomy gives you. Actually, there wasn't. This key code gives you the list of disease names code anatomy provides and tells you what to write. Okay, now that was on me to read it right. Okay, so now that we have that, I will just go ahead and type name the option just to see what it yields. Name the option, run the code, and let's see here. Uh, close hint. Uh, okay, so in this case, I'm still not familiar with the kind of disease this could be, because there are so many lists of them here. So what I'm going to do is to use Google to map out what this disease could be. So now, what can I tell Google to kind of like give me a clue of what the disease could be, so I can match it with the words that I see here, or Bing. It might not be Google that I might use, but I could use the GPT-4 because it's faster. So I'm just gonna go here, and I'm gonna type um let me just type interruption of blood supply. Interruption of blood supply. It could be cholesterol. I don't know. Because it says here, oh yeah, it could be cholesterol. Because it says here. that high blood pressure, smoking, diabetes, high cholesterol. So this this could be a sign of a disease. This could be diabetes. I'm not really sure, but I'm gonna find out soon. Um, so interruption of blood supply to, let me check what I wrote there or what has been written there, to the brain. So interruption of blood supply to the brain. Um, what you asked it, what disease could that be? Let's do it like that. Let's see. Um, okay, so it gave me multiple ischemic stroke or hemorrhage, hemo hemorrhagic stroke. I still don't know how to pronounce that. Okay, but let's see if we can find this wording on the disease names. Let's see if that's what yields the result. Okay. Okay, so I'm seeing something similar. You can see here. I'm seeing some sort of similarity between these hemorrhoids or hemo hemorrhoids, something like that. Um, could that be it? Maybe I should try it, but let's keep going to see if we can find something. Um, let's see if we can find something. Celiac disease, gastric reflex. Okay, so this one's deals with all right, let me try this. There is a similarity between this and this. So I'm just gonna go and I'm just gonna try it and see um to know if that's the answer, you know. Okay. So name, again, you could type name or you could type disease. Let's see what it told us here. It says right name or disease. So whichever one, but I would just go with disease. And this is a disease name. And let's see here. Let's go back to the name of what we hyper. Where is it? Where is it? Where did I just saw it? Yes. So it might not be it, but let's try it. Hemorrhoids. Hope I spelled it right. Again, your spelling needs to be correct. Just making sure I'm checking my spellings. And run. Okay, so nothing showed up, which is okay. Now let's go over to the next one. So dysfunction, testicular, Parkinson's, Alzheimer's. Okay, now I think we are getting into the, oh, stroke. Would you look at that? I'm seeing stroke. So let's see. And ischemic stroke, hemorrhagic stroke. Interesting. Stroke could be it. Stroke could be the one that I'm looking for, because even the type, like even the with the option that I saw on the GPT-4, it kind of leans towards stroke. So stroke most likely is the disease that kind of like interrupts blood flow or blood supply. Let's try that and see. Uh, disease, stroke. Let's see. I think something popped up and I think we made a progress. Oh, would you look at that? All right, right. So we have what we need. Okay, so stroke could be the name that aligns with the symptoms, which is correct. Stroke it is. And because we made progress on the clinical side. Okay, so now that we have that, let's go back to the scenario. So we have found the organ, we found disease. We found the cause of the disease and the remaining treatment. So it says here treatment options. So let's try and see the hint that is associated with treatment. Let's see what we can find there. Uh, okay, so mm, treatment, 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 treatment. And for some reason, he's not here. Why isn't he here? Interesting. Okay, so since he's not here, I would upload, uh, uh, you know, I would upload the treatment there or the hint for the treatment there. However, what we could just do, I already know the code for the treatment. Um, or I could just type this hint because for some reason I couldn't see it there. But what I could do here is to type hints and now that I have it, you see, treatment does suggest. Let me see if it's still there. Nope, it's not there. Okay, so you see here, treatment does suggest. So I'm just gonna go ahead and copy and paste this because this is what we need. Just go ahead and copy and paste it. My apologies on not finding the treatments on there. So what I will do is to upload the instructions for the treatment as well, so that you know you guys wouldn't be left in the dark. So I'll just paste this here and now let's see what it yields. So mm-hmm, and I really do not see anything pop up. Why is that? Uh, and why is that? Let's see. Come on. Treatment that suggests. Uh, Let me type it up. Let's see here. Oh, would you look at that? All right, so we have what we have here, and treatment that suggests worked. So what we're going to do is so to treat this case, one of the treatment is rehabilitation, and it's telling us what right here, treatment that use or vice versa. So basically, if we write this, which means that we've used the treatment and it costs us um 5 biocurrency. So since I have enough of it, I guess I will just go ahead and use it to complete the case for today. So what I'm going to do is to write treatment dot use, and now that I have treatment dot use, let's see here. And you can see here completed one clinical case, you know, and 5 biocurrencies. So you could see that we have clinical case complete. So that is how to solve clinical uh, case.